Hello, good afternoon. So we have finished the role of the healthcare professional and we're now doing the interpersonal communication. So this is another 3 credit unit that all of you will be studying when we come back. We'll be doing this alongside the note-taking module. So your 2 units for this half of the half term is interpersonal communication skills and note-taking. So interpersonal communication, we have 3 tasks. So our 3 tasks that we're going to be doing are a presentation for task 1. So we can do this on a PowerPoint Prezi. We have a role play you're going to be doing, and we also have an assignment that we're going to be doing for task 3. But this video will just tell you what we need to do for the task 1, the presentation. So the assessment criteria in which we're going to be looking at are these 2 here. So we have 1.1 and 1.2. So your 1.1, we're evaluating the methods of communication. So we're going to be looking at different forms of communication and how that can take place. We also have explaining the factors that can influence communication. So that could be barriers, space, proximity, tone of voice. So these are your 2 assessment criteria. So we have one that says evaluate and we have one that says explain. So this is for your PowerPoint presentation you're going to be doing in groups. So for task 1, you will be in groups of 3-4. So for people in my group, the PowerPoint is already up on the Edmodo. So if you look at the last slide, I've actually grouped 2, and Paul's in the process of also doing that with the other group. So you could be in groups of 3-4, you'll be producing about 10 to 15 slide PowerPoint with your group. So hopefully each member will have 3-4 slides to produce. So your first slide, hopefully we will have on the what a definition of communication is. So I think that's a very good starting point. So we're going to define what it is, and then we're going to go into looking at the 3 methods of interpersonal interaction. Okay, so for example, you might want to look at here. So it says sign language is an example of a method of communication for someone who has a hearing loss. With that, obviously, you will explain what sign language is. You'll be looking at the strengths and weaknesses of using sign language, and you'll also be finally explaining what obviously some of the influences that could be. So on here it says noise, obviously how the interpreter, having to make sure you speak slowly. So that example about someone who is deaf, you can see that sign language is the method of communication, and the influences are noise, it's having to speak slowly, and obviously employing an interpreter if someone, obviously if the person needs one, because they can't obviously, the social worker or nurse cannot use sign language. So that's an example there. So you will be in groups of 3-4, you will have about 10 to 15 slides, and as you can see here, it's looking at assessment criteria 1.1, 1.2. So this is obviously me breaking down the brief. We also have on this side of the classroom, I've just done a little whiteboard presentation. So here, to remind you what some of the methods of communication are, we have group communication. So ironically, you're actually going to be doing a group presentation. So that is an example of you selecting a method of communication. 3-4 of you are going to be presenting your PowerPoint. So that is a form in itself. We also have one-to-one communication. So that could be usually verbal communication. So usually with one-to-ones, it's much more private, it's much more personal. The strength of that could be that the person might feel like they can talk more. When you're in your group communication, it can be quite uncomfortable because you know that you're being judged, people are hearing you, and you need to be usually a bit more confident. Whereas one-to-one, you can get a lot more from your clients, they can speak more, and it's much more private. So just a little example of strengths and weaknesses there. Sign language is another form of communication method. So if someone's got hearing loss, we know that already. You can maybe do sign language, or we have written communication. That is another form of non-verbal communication. So written is quite good because obviously you can express yourself without having to think carefully as you speak. So it gives you more time to write things, and you make sure you get your points across. However, with that, it can be quite frightening because the other person might interpret it a little bit different. So I think most of you have had experience with that with text messages. You write a message, and then you send it, and the other person takes a complete wrong angle. So that's a little evaluation there. Group communication, I've said already. So these are just some of the methods of communication. There are many, many more, but that's just me thinking about what some are at the top of my head to get you thinking. So when you're evaluating a method, it does kind of already link with factors affecting communication because you're evaluating the strengths and weaknesses. So automatically it does kind of, if you do a very good job of this, you'll hopefully have some of the factors already in that you need to consider that can affect communication. But some here that I've got, so these will be with the last 4 or 5 of your slides of your PowerPoint. You'll be focusing on this. So environmental environment is a factor. So the lighting in the room, is it good? Is it dim? Is there a light turning on and off, which is quite distracting? You know, so if you're a nurse and you're giving some bad news to someone, you've got to think carefully about the environment you're in. Is it quiet? Is it quite therapeutic? Is there good lighting? You're not going to be disturbed constantly by people coming in and out. So you've got to really think about this when obviously you're in practice, because if the room's not conducive, it can obviously impede further stress for the patient. Role of the professional, so your role in itself can be a barrier. So if you're a social worker, automatically, some people might hate you because they automatically think you're going to take their children away. So it kind of puts people's backs up straight away, so you kind of have to prove yourself that that is not what you're there for, you're there to help. So you think of the role of power that can affect communication. Verbal communication is many of the factors you've got to think about. So your gender, you've got to think about your man, woman. So if you're working in domestic violence with women who have been victims of crime, maybe a man perhaps, being a man, yourself helping a person can be quite problematic. So usually your gender, let's think about that. Tone of voice, facial expressions, so how obviously your face, how you appears. Body language, are you like this? Are you quite angry, distressed, or have you got an open body language? Some other things you have to consider. Age, obviously patient's health, so are you, is the patient in good health? If they're in really good health, that'd be quite good, but if they're having a very bad day, they're on lots of drugs, that's going to affect how that person responds to you. So me working in the hospice, when I was in Watford, most of the people was quite sleepy because they'd just taken some drugs. So I had to think very carefully about when I speak to that patient, when I communicate with them. So patient's health is a very big factor as well. Disability, proximity, there's some other ones. So the person's got hearing impairment or the blind, that could obviously be a barrier you've got to think about carefully as well. So you can see there's so many barriers there which you can think about that may affect the communication. So there's no kind of right or wrong answer with that. So hopefully we can see how this links to this over here with the methods of communication. They go hand in hand. So what I want to do just now is I'm just going to run through some of the points that we need to know, which some of you may be thinking now as I'm talking to you. So just to summarise, you've got assessment criteria 1.1, 1.2, you're going to be doing a group presentation, you're going to be preparing this the first week you're back, so I think it's the 2nd, 3rd of November, if I remember rightly. The week after you're going to present it, so that'll be the 10th, the 11th, so you're going to be presenting your PowerPoint to myself or Paul. You won't be doing it in front of everybody, you'll be doing it sat down with me at the table, and you're going to be marked straight away, so you'll know whether you need to do some further changes. So you're going to be presenting it the week after. I want to see definitions in there, so when you're looking at communication, what is communication? That should be on the first slide. I want to know what the definition of method of communication is, what's the method of factors that can affect communication, so please break them down. I want I want some case examples in there, so when you are talking about factors affecting communication, please put 2 case studies in there, health and social care related, to make sure you are evaluating and that you are explaining the factors in detail. So I do want some case examples in there. Whether in the middle or at the end, it does not matter. You know that you're going to be sat down when you're presenting it. You know that it should be at least 2 to 3 slides per student. It is your responsibility to make sure that everybody has it saved on your memory sticks or emailed, because in the past some people do not obviously come on a day when they're supposed to present, which does cause problems for the group. So if that does happen, please make sure you have it saved on a stick. You can just go with it, and the person with a stick, they will have to obviously do a separate task. So make sure you work together, make sure you all take responsibility for saving the work together. Pictures can be included for the PowerPoint, that's perfectly fine. References, they can go at the back of the PowerPoint, that's fine. And remember to prepare for the 4th of November, and you'll be presenting on the 11th of November. The whole unit, the whole of interpersonal communication, will be due in on the 8th of December. Okay, so your task 1, task 2, task 3 will be done. So as you can see, this unit is very, very practical because it is communication, and so you'll be doing some kind of role plays, you'll be doing presentations with a little bit of writing. So we'll make it a bit more fun and hopefully a bit more practical. Thank you.